Okay, hello, hello. Thank you so much for being here with us today. Let's just jump right into it. So, my first question for you, may you please introduce yourself and tell me a little bit about yourself from a personal and professional perspective?
Thank you. I'm Carol Cowan-Levine, and I have the privilege of chairing the board of directors of Ellie's Place. My first degree is in social work, master's of social work, but I have spent many years in the field of psychotherapy, went on to do additional degrees. And I have, since I was very young, always wanted to give back. So I've worked very hard in a variety of different areas in the community, predominantly in healthcare, really wanting to make that difference. So I really have often found myself in the trenches speaking for those whose voices really have not been heard, and really undertaking to support the underdog and really begin to ensure that change can happen. Well, that has predominantly been the driver for me. I practice in private practice and have for 30 years, but I also serve on a number of hospital boards of directors, as well as agency-based organizations. And I've really taken a lot, and I think given a lot as well in wanting to see change.
Lovely. And you have such a breadth of experience, and I think that's amazing. When we look at those experiences, do you see any opportunities in incorporating your learnings, whether that's in your private practice or some of the other volunteer work that you've done within Ellie's Place and our recovery model?
So I think that one of the reasons that I accepted the request to join the board of directors was that I could bring some of my knowledge and acquired experience to that board of directors to help move it from its early beginnings into a more strategic, effective kind of response in order to achieve the mission and vision that we have established to date. So I think I have grown with it, but I am helping it to grow. I think the greatest motivation for me is in response to the significant number of gaps in the system that I have observed, both as a professional and personally in my own journey with my daughter. And these are not modest gaps, and they generate enormous suffering, a lack of services, wait times, a dismissiveness and a lack of responsiveness to really the profound suffering that is going on. And not everyone has access to the breadth of possible resources that I had. And even so, in all of my capacity, having worked in the field, even I could not relieve my daughter's suffering and find the appropriate resource for her before she ended her own life. And it is in response to that and all of the others who have struggled with this, the impact on the family and the ripple effect into the community, that I really decided, in spite of my own pain, to really reinvest in making a difference.
Awesome. When we look at this conversation of mental health, what is it that you'd like to add?
I think that the whole health issue of mental health still brings a lot of stigma with it. I do not think it is embraced in the same way that physical health is. You certainly look at the response of many to the homeless and those who are seemingly out of touch with reality, even on the street or elsewhere. People move out of their circle, not into their circle. It is quite a different response than those who have cancer or some other physical challenge. And in light of that, it really is because of the unpredictability in behavior, the anxiety it generates, and that really has us not as supported or as understood as I think we really have to be. That links certainly to Ellie's Place, to the previous question, which is the impact in our own family, my own family, of mental health, and the ripple effect profoundly debilitating ripple effect that health issue has in families and into the broader society. So I think we have a long ways to go still in helping people to really understand mental health as health.
Mm-hmm. Definitely some really good points you touched on there. Even when we look at stigma, that in itself, through my experience, let's say at school, some people just don't talk about it. They just simply put it on the back burner, right? And I think there's so much work to be done for sure in opening that conversation. And we can only do that through realizing and recognizing and trying to implement that change. Thank you for sharing that. And I wanted to ask, so from your perspective, where do you see the recovery model of Ellie's Place? How does that provide something different from what already exists in the current market?
Well, the model of Ellie's Place really addresses a gap, I think, in our Ontario system, if not Canada's system, which really gives those suffering, a sense of community and support that they may not otherwise find, and not find with the intensity and all encompassing environment that really might help one begin the recovery process. So I think that that's important to consider, of an all-encompassing, enveloping kind of environment, which is quite distinct from your once-a-week psychotherapy appointment.
100%.
Yeah.
When we look at Ellie's Place's tagline, where recovery grows, what does that mean to you?
Recovery isn't a finite moment in time. It is a process, and a tiny seed, if I could build on that metaphor, gets planted. You have a moment of hope. You have 40 seconds of feeling like, I can do this, and then you may well drop back to below the line. But it is in planting that seed and knowing that it will germinate and begin to offer you the opportunity of something else, and to really experience that. But it's a long process, and I don't think it's very different than recovering from any other health issue. There is a process.
Mm-hmm. I completely agree. Thank you so much for your time. I think your insights, your passion definitely drove home, and Ellie's Place is very, very lucky to have you. So thank you.
You're welcome. Thank you for your interest.